Yeah, that's a common question and situation in the field as well. And similarly to the previous question about co-infections in the nursery, in the sow herd is similar. We always need to consider diagnostic investigation when we have clinical signs like abortions. And the main recommendation is to go through different steps during this diagnostic investigation, starting with the production impact on abortions. If we're having abortions or other reproductory clinical signs, we really need to identify if this is significant or not in terms of productivity. The next step is to start differential diagnostics, because we know that other pathogens and even non-infection factors may produce abortions, right? So we need to really go deep on the investigation and find the root cause of the abortions. If we at the end find that PRRS is the cause of this, then we implement a contingency plan, which is established in the systematic approach program as well. But it's very important to start just confirming the cause of the abortions in terms of productivity and also the root cause of these abortions. When we run the diagnostic investigation through all the steps that we already mentioned, and we identify that PRRS is the cause of the abortions, there's contingency plans that we can put in place. The first one is to consider that as part of the expectations, we can have a clinical signs in a vaccinated breeding herd. We know that vaccination doesn't prevent infection. So if we have breach on biosecurity or introduction of replacement gilts that are bringing a new strain, we won't stop the infection and we're going to have some clinical signs, right? But the expectation on this vaccinated breeding herd is to reduce that severity and duration of clinical signs. Now, there are plans that we call contingency plan that we can implement. The first one is to identify when was the last mass vaccination in the breeding herd. Once we have that, and if we figure out the last vaccination was 4 weeks or more, the recommendation then will be to implement what we call emergency mass vaccination or therapeutic vaccination. With this, the objective is not to stop in 100% the abortions, but significantly reduce the shedding and also number of abortions that we're having in the population. Also, along with this mass vaccination, if it is possible, the recommendation also is to plan on herd closure. So the first option will be to combine herd closure and mass vaccination if that's possible. The second option, if herd closure is not possible, just do the mass vaccination. And along with that, always is very important to work around management practices, try to minimize the piglet movements in the farrowing house and increase biosecurity, internal and external biosecurity.